Hi, I'm Colby Feeney, and I'm the director of the Duke Internal Medicine and Pediatrics Residency program. At Duke Med-Peds, we are training the future leaders of physicians. Physicians who will care for patients across the age spectrum, provide high quality and patient-centered care. Physicians who will become leaders in their own fields, whether that's primary care, hospital medicine, or adult or pediatric subspecialties. Training at Duke occurs at 3 main sites, including Duke University Hospital, which has an integrated children's hospital within it, the Durham VA, which is directly across the street, as well as Duke Regional Hospital, which is our community hospital about 10 minutes north of Duke University Hospital. We are fortunate to have a huge Med-Peds presence here at Duke, with more than 50 faculty and fellows who are Med-Peds trained across the health system. That's in addition to our 6 core faculty in Med-Peds Clinic, who are really cornerstone educators for their residents during their training. Our residents are incredible, bright, hardworking individuals with diverse interests and backgrounds. Now we are going to show you around and let you meet some of them.
A typical day on Gen Peds, you're divided into one of our many Gen Peds teams. You either are on a general pediatrics team, so that normally focuses on the bread and butter pediatrics. We also cover patients in endocrinology, pulmonology, and neurology on these teams too. There's also a team dedicated to cardiology and nephrology, and then another team that's dedicated to hematology oncology. The final team is dedicated to our complex care patients called the Worley team, and a lot of times these patients are in and out of the hospital frequently, and we build relationships with the families as well as the patients.
One of my favorite things about the MICU is that the resources are unlimited. Not just the equipment and the lab tests, but the people. So we round with a pharmacist every day who can answer questions in real time for us. We have interdisciplinary rounds after formal rounds where we work with PT, OT, speech, among others.
We take care of patients that really come in from all kinds of hospitals outside of Duke, so they tend to be much more sick and have multiple medical comorbidities, and we see kind of everything from patients who are having trouble breathing, so acute hypoxic respiratory failure, but also patients with severe metabolic disturbances, so related to DKA, and also patients who have pathology related to really aggressive cancer that we're trying to treat here.
I've really been challenged over the last couple of weeks to learn a wide variety of skills, from building broader differentials to learning procedures such as putting in central lines and arterial lines. Things that I was terrified of in my first year, I am now feeling very confident and comfortable doing.
Hey, I'm Dana Clifton. I'm one of the Associate Program Directors for the Med-Peds Residency Program at Duke. Residents get the opportunity to practice bedside ultrasound and various procedures on patients all throughout the hospital. So we perform procedures such as thoracentesis, paracentesis, central line placement, arthrocentesis, abscess incision and drainage.
One of my favorite things about the program has been the balance of supervision and autonomy. I can remember on multiple instances overnight when taking care of patients either as an intern or a PGY2, moments where I knew that I had to make decisions immediately for the sake of patient care, but that I also could call a fellow or an attending and get backup or advice seconds later. And even if I hadn't made exactly the right split-second decision, the people that I spoke to were always happy to talk through what I had done, help work through any other scenarios that might come up, and I felt very supported both in decisions that I'd made, but in also my medical learning, the whole process, and in patient care generally.
I'm on the Med-Peds ambulatory rotation. We rotate through a variety of clinics, including rheumatology, hematology, adult congenital heart disease clinic, and the transition clinic, as well as our own continuity clinic throughout the week. The podcast curriculum is a unique thing set up by Colby that we listened through during our first rotation through. A lot of tips and tricks on how to perform transition as they go into adulthood, transitioning their providers, kind of what things to counsel on.
The Lincoln Clinic is a really unique opportunity that we have here at Duke Med-Peds. Lincoln is a federally qualified health center that's here in the Durham community and has been for many, many years. It serves under-resourced patients, almost entirely uninsured, and really aim to get exposure to working within a federally qualified health system model. They have a pharmacy on site that has formulary medications at very reduced prices for their patients. We have a chance to learn a little bit more about the population that we're serving training. We also learn about senior pharmacists, so thinking about how to connect our patients better to pharmaceutical services and access to medications. We spend time in the tuberculosis clinic in Wake County and the food bank within our own HOCC.
I'm Chris Prater. I'm an Associate Program Director for Duke Med-Peds Residency Program. I personally have a background in primary care and refugee and immigrant health. I have about 10 years of experience working with predominantly non-English speaking patients, and I use that knowledge to help train residents how to deal with patients from different cultures, different backgrounds, different countries. We place special emphasis on learning about disparities, health inequities, and learn about advocacy that better helps patient care. So when we have preclinical conferences at the start of every continuity clinic, we make sure that we specifically address the inequities of that particular health topic. By adding extra layers of education about health inequity and structural racism, we believe we can help trainees become better persons, better humans, but also can launch into careers of advocacy and be community leaders in the future.
My name is Carolyn Avery. I'm a Med-Peds preceptor here at the clinic, and I also serve as the medical director for our resident clinic. So one of my favorite things about this clinic is all the resources that we have available for our patients. We have social workers on site, we have 4 Spanish interpreters, we have a mental health team. We also have tons of social resources for our patients, like community health workers, an on-site food market, and diaper bank. So we're thrilled to be able to offer so many resources to our patients right here within our clinic walls. Our residents really serve as the primary PCP for their patients. We do our best to keep that continuity with them. We have patients that years later will ask us how so-and-so who graduated is doing. They really see the resident as their primary doctor.
I think that the Med-Peds clinic here is a really unique opportunity during residency to take ownership of your own patients. It's very unique to be able to see this dynamic during your training, as well as to have a balance of adult patients and pediatric patients in our clinic. I think the Duke Med-Peds program is the best in the country.
One of the things I would encourage someone who's considered this program is to look at what they see themselves wanting to pursue in their career. And so for me, I'm interested in global health work and getting involved in research work and clinical work in areas of lower resource settings, and there's a variety of faculty here that are doing really fantastic work there.
The Triangle area is fantastic. Having come from a big city like Miami, Florida, I was nervous that I wouldn't be able to do a lot of fun things like I would back in the city, but I'm actually having the time of my life here.
Since getting here, I've been so happy with how easy life is. I love the easy access to the outdoors. I can bike to work. Getting around is easy. I live across the street from a grocery store. I can afford to pay rent here. There's just been so many wonderful things about living here that have just overall been really, really easy.
If you have children or if you have a family, it's a great place to raise kids. There are great schools in the area, great daycares. There are other residents with children.
I came here for residency about a decade ago and can't even think about leaving still. It's a really great place to learn, to teach, and to grow as a physician and a human being.
For me, I knew that Duke was a right fit because I felt like the residents were friends at work and outside of work. You know, when you're in residency, you're going to spend a lot of time working long hours, but it doesn't really feel like work when you're around people that you actually have fun with and care about.
We talk about the Duke family here quite a bit, and it lives up to its word. You're truly with people who care for each other, care for the patients, and care for the community too.